Hey, Dr. Vicky here. Boy, do I have a case for you. So, a gentleman, and he's actually an athletic trainer. So, he's not new to the sports industry. So, he's been doing this a long, long time. And he's had a few concussions along the way. And his body is starting to break down. He's early 30s. And basically, what happens is he has an uncontrollable neck movement where his head will be thrown off to the side, and this has been happening over and over. He has movement of his mouth, which he wasn't aware of until he came in for an evaluation. And what I wanted to determine was it the opposite brain that was causing it? Was it coming from the midbrain area, which I was leaning to both of those areas of involvement and possible balance center issues as well. So when I was having him do eye movement, and what I would do is have him go to one side or the other and hold it there and see if the writhing stopped. And that, in conjunction with some brain work at the same time, seemed to stop it in its tracks. And so that was really cool. So I did some calming, I did some brain balance, which is an anti-anxiety protocol, so in addition to the other things. And I was interested in possibly doing some cranial nerve work, and I didn't get to that because we ran out of time, because we were doing some other things, and it seemed to work. So the next visit, so I've seen him once. So the next visit, and unfortunately he can't come in very often, he lives in another town. So we're going to try to do some other things in addition to that and see what happens, because that'll give us an idea of how his nervous system is performing. So these treatments won't necessarily work for the next person that has the exact same presentation, because their brains are different. So their activation of their neurons in their brain is different. So when you try to stimulate certain things, it will work sometimes for a while, but sometimes you have to integrate other things. I find this to be true in almost all of my patient base, where maybe it'll work for a couple of visits, and then you have to tweak it and you have to figure out some other avenue because you've hit your max improvement there. So the brain is moldable, so you can't just think one thing is going to work for the entire time that you're working with this individual. So if this sounds like you, if you've got somebody that you know that has some issues, neurological issues due to a brain injury or unknown causes, sometimes people forget. I mean, we forget our traumas, right? And it doesn't even matter necessarily what those are. It's very helpful if we can hone in on certain things that could have been a problem, like a toxicity issue with work, and so we can kind of figure out which tissue is most likely to be the main issue. So a lot of the factors really do matter. So if this sounds like you, give Souter Chiropractic a call. I can be reached at 303-385-3432 or souterchiropractic.com. I also do animal chiropractic, and I can be also reached at Souter Dog Chiropractic.